Hey, what's up, everybody? This is Jacob. I'm a dermatology physician assistant, and I wanted to make this video just comparing the difference between a physician assistant versus a medical doctor, especially if you're on the edge of trying to decide between whether or not to go to medical school or whether or not to go to physician assistant school. A physician assistant, for those of you who don't know, is a healthcare provider with a master's degree who practices underneath a physician's license. And a physician assistant on a daily basis sees patients, makes a diagnosis using physical exam and orders tests, can prescribe medications and do procedures that extend a physician's care. So anything that a physician feels comfortable with their physician assistant doing, that physician assistant can do. And so a physician, on the other hand, is, of course, a four-year medical degree with a three-year residency and 3 to 5 year fellowship. As a physician, you can practice independently or at a solo practice that you own, or you could look into joining a group specialty. So what are some advantages of being a physician, and what are some advantages of being a physician assistant? Well, I came to this crossroad a little while back, and when I was trying to decide to go whether or not to go into physician assistant school or physician or medical school, one of the things that I looked at was first of all the amount of time and the amount of debt for both of these career paths. As a physician assistant, you're looking at, after you get your bachelor's degree, a master's degree, and typically these programs range from 2 to 3 years, with 26 months being the average. And so you're looking at 2 years where you're going through training, you're taking out debt, and then you begin to earn an income from that point forward. As a physician, you get your bachelor's degree, and then you're looking at 4 years of medical school. And after that 4 years of medical school, then you might have some smaller salary as a resident and as a fellow. And so you're looking at a total of, after your bachelor's degree, as a physician, a minimum of 7 years, most likely 10 to 13 years after your bachelor's degree. So there's a lot of work as a physician. Obviously, you're going to have a commanding salary, but being a physician assistant, the pay isn't that bad. The average salary for a physician assistant is $103,000, with some specialties paying quite a bit more than that. So depending on the specialty that you go in and the amount of hours that you're working, the amount of revenue that you bring into a practice, some PAs can do really well. There's some PAs that are making $200, even $300,000 in certain medical specialties, and a lot of that just has to do with how many patients you're seeing, how productive you're being, as well as your agreement with your physician or whoever it is that you're working for. So the earning potential is still there with a physician assistant, and there's much less as far as how much schooling that you actually need to do. And also, I always consider that time where you would otherwise be in school, but you're actually making money. So you have to kind of think about that if you're also kind of considering the financial aspect of all that. Physician assistant also, one great part about being a PA is the flexibility. I work in dermatology, but you can work in cardiology, general surgery, endocrinology, primary care, interventional radiology. There's numerous specialties that you can work in, and you're not stuck in one specialty. You know, if time goes by and later in your career you get burnt out, you can always switch, and that's one of the best advantages of being a PA. There's always something new that you can achieve, and there's always a different place that you can be. There's also, from my experience in general, PAs have a little bit more ability to spend time with patients, as the physician's more specialized in certain procedures, and so anything that you can do to extend their license and to practice medicine is going to be considered valuable. And so, like in the clinic that I work in right now, is in dermatology. I see patients for their skin exams, and I do biopsies. And when we find skin cancer, then the physician I work for is the one that removes that skin cancer. So most of what he does is actually the procedure or the surgery side, and I'm doing a lot of the patient education before the procedure as well as after. And so I get to spend a lot of time with patients. Patients get to know you quite well. You get to develop a relationship with patients depending on the specialty, and so all those aspects are really positive. Some of the disadvantages of being a PA, and or that would be an advantage as a physician, is when you're a PA, you're not when you walk into the room. There are always going to be those patients who want to see the doctor. They want to see the guy that went through 13 years of schooling, whether or not it would make a difference in their care or not. There are some people that just look down on the PA license or the PA profession. But I've kind of found that those people are few and far between. And many times, those people who are skeptical about seeing a PA, once they see a PA, their mindset changes quite quickly. And working for a physician that backs me up and also supports the PA profession has been a huge advantage for me in allowing my patients to accept me as their provider. And I've really made a big difference in a lot of these people's lives because of that. And so there's a lot of advantages to being a PA. Of course, as a physician, you're going to have a salary that is uh, much more in general than a PA, ranging anywhere from 189,000 in primary care all the way up to 500, 600,000, even more as a orthopedic surgeon or some of those other lucrative specialties. But there's also not as much flexibility. You're stuck in that one particular path, and many times the physician has to work longer hours than the PA. Not in every case, but in many cases, if somebody breaks their leg at 3 o'clock in the morning and you're working in orthopedics, you're coming in and you're on call, and a physician has to be there for those types of surgeries. And so there's a lot of hours that these physicians are putting in, and a lot more in general than a physician assistant would. And so, however, they obviously have had more medical training, and they've also they're going to be a little bit more respected in the medical community for that purpose, which they deserve that, right? They went through an additional 6 to 9 years of their lives in school. But I also kind of think from a standpoint of enjoying enjoying your youth and enjoying your younger years. As a PA, you can be making money quickly. You can finish up PA school and you can be out making money and not be studying. And when you look at the long run, those years where you're earning a physician assistant salary rather than being in medical school, they add up. So those are all just some things to consider. You have to really think about it for yourself. If you feel like you have a calling to be a physician, definitely pursue that calling. The doctors that we have in this world, we need more of them. And we need people who are willing to be proactive and who are willing to really dedicate themselves and their lives to helping and serving others. As a physician assistant, I like being able to go to work, putting in regular hours, 8 to 5, not worry about managing a business, worrying about hiring and firing staff, managing the books, paying rent. I don't have to worry about any of that, and I still make a fairly decent salary and fairly decent income. And so that's a really nice perk. And so you just have to think about it, really consider a number of those factors. I'm going to make a few more videos here. This is my first video, but I'm going to be making some more videos here. One of them will be about how to prepare for physician assistant school, as well as how to apply to physician assistant school. Some of the things that we'll also discuss will be how to prepare for the a PA school interview, how to prepare for the GRE exam, which is an exam that a lot of these schools are looking for. Another will also be talking about some of the healthcare experience that you are required to have to become a PA prior to getting into PA school. So I'm going to make a few more videos about that here. if you like this video, please smash that like button. I look forward to seeing you and addressing you again.